This is my student support system. Keep watching, keep learning. Hello, welcome to my student support system. In today's class, we will discuss about pain, pain management, pain assessment, and what are the types of pain. Let us start. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture. Or you can directly visit to channel My Student Support System. What is pain? Pain is defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. It is the most common reason for seeking health care. Example, backache, headache, toothache, etc. Now we will discuss about types of pain or classification of pain. Pain is classified into three basic categories: acute pain, chronic pain, and cancer related pain. We will discuss now them one by one. Acute pain. Acute pain is of recent onset and commonly associated with the specific and recent injury. Acute pain indicates that damage or injury has just occurred. Acute pain usually decreases as the healing occurs. Acute pain can last from few seconds to even 6 months. Chronic pain. Chronic pain is constant or intermittent pain that persists beyond the expected healing time, that is 6 months, and normally is difficult to associate the pain to the specific cause or injury. Frequently, nurses come across such patients in community-based settings. Now, cancer-related pain. Pain associated with cancer may be of acute or chronic type. Pain in the patient with cancer can be directly associated with the cancer or as a result of cancer treatment like surgery, chemotherapy, or radiation therapy. Harmful effects of pain. Effects of acute pain. Now we will discuss. Unrelieved acute pain can affect our whole body. The pulmonary, cardiovascular, gastrointestinal, endocrinal, immune system are affected by the acute pain. The stress response, that is neuroendocrine. The stress response, neuroendocrine response to stress, occur with severe pain. The widespread endocrine immunology and inflammatory changes that occur with the stress response can have significant negative effects on the body. The stress response occurred due to severe pain may increase the risk of physiologic disorders such as myocardial infarction, pulmonary infection, venous thromboembolism, and prolonged paralytic illness. Patients with severe pain and associated stress may be unable to take sleep, deep breaths, and may experience increased fatigue, decreased mobility, and decreased sleep. Chronic pain. Effects of chronic pain. Chronic pain also affects our body in same manner as acute pain. In addition to that, chronic pain leads to suppression of the immune function. Associated with chronic pain may promote tumor growth. Chronic pain often results in depression and disability. Patients with a number of chronic pain syndromes may report depression, anger, and fatigue. Disabilities may range from an impaired ability to participate in physical activities to an inability to take care of personal needs such as dressing or eating. Pathophysiology of pain. Pain experience involves activity of nociceptors. Nociceptors are neuronal receptors involved in the transmission of pain to and from the brain that respond to biochemical mediators, or noxious stimuli. Nociceptors are free nerve endings which are situated in the skin, and they respond only to intense, potentially damaging stimuli. Such stimuli may be mechanical, thermal, or chemical in nature. When these fibers are stimulated, histamine is released from the mast cells, causing vasodilation. The cutaneous nerve fibers further branch and communicate with the paravertebral sympathetic chain of the nervous system and with large internal organs. As a result of the connection among these nerve fibers, pain is often accompanied by vasomotor, autonomic, and visceral effects. Nociception continue from the spinal cord to the reticular formation, thalamus, limbic system, and then cerebral cortex. The involvement of reticular formation, limbic and reticular activating system, the which is the responsible for the individual variation of the perception of pain, because same pain may be perceived differently by different individuals. The descending control system is a system of fibers that originate in the lower and mid portion of brain and terminate on the inhibitory interneural fibers in the dorsal horn of spinal cord. This system is always active. It prevents continuous transmission of painful stimuli partially through the action of endorphins. Cognitive process may stimulate endorphin production in the descending control system. There is gate control theory of the pain described by Melzack and Wall in 1965. This theory proposed that the stimulation of skin evokes nerve impulses that are then transmitted by three systems located in the spinal cord: the substantia gelatinosa, the dorsal column fibers, and the central transmission cells. The noxious impulses are influenced by gating mechanism. Stimulation of large diameter fibers inhibit the transmission of pain, thus closing the gate. And conversely, when smaller fibers are stimulated, the gate is opened. The factors which affect pain response include past experience with the pain, anxiety, culture, age, gender, genetics, and expectation about pain relief, etc. These factors may increase or decrease perception of pain. Past experience. The people who have had multiple or prolonged experiences with the pain will be less anxious and more tolerant to the pain than those who have little experience. However, individual variations may be there. Anxiety and depression. Anxiety that is relevant or related to pain may increase the patient's perception of pain. Anxiety that is unrelated to the pain may distract the patient and may actually decrease the perception of pain. Culture. Understanding about pain and how to respond it is differ from one culture to another. Early in childhood, people learn from those around them what response to the pain is acceptable or unacceptable. Aging. A gradual reduction in endoneuronal blood flow with increasing age, which may contribute to reduced peripheral nerve function and diminished pain perception. Old age people are reluctant to seek help even when they are in severe pain because they consider pain as part of normal aging. Now, assessment of pain. How we will assess? Assessment is an essential step in pain management. Following parameters may be used for pain assessment. This is pain location, intensity, timing of the pain, quality of the pain, and aggravating and alleviating factors. First, we will see location. First parameter is location of the pain. In this assessment, a form may be used which include drawing of human figure or human body on which the patient is asked to shade the area where pain is involved, where the pain is felt. This is especially helpful if the pain radiates. This data may help in making diagnosis or cause of the pain. Intensity. Pain intensity is very subjective. The reported intensity is influenced by the person's pain threshold. The smallest stimulus for which a person reports pain and pain tolerance. The pain intensity may have a range of no pain, moderate pain, or excruciating pain. Timing. Under this parameter, the nurse inquires about the onset, duration, relationship between time and intensity, such as at what time the pain is worst, and changes in the rhythmic pattern. Quality. Under this parameter, the nurse asks the patient to describe what the pain feels like. The nurse must record all the words in the answer that said by the patient. If the patient cannot describe the quality of pain, then the nurse can suggest the words like burning, aching, throbbing, or stabbing. Aggravating or alleviating factors. Under this parameter, the nurse asks the patient about what make the pain worse and what make it better, and asks specific about the relationship between activity and pain. This helps to detect factors associated with the pain. Now we will come to pain management. Pain management is the process of relieving pain and increasing comfort. It is an essential part of patient care. Pain management requires two types of strategy: pharmacological management and non-pharmacological management. Pharmacological management, there are a lot of pain medications which are prescribed by the treating health professional or doctor to relieve pain. These medications are to be administered as per prescribed route, dose, and schedule only. Non-pharmacological management. Non-pharmacological management of pain include massage, thermal techniques such as hot and cold applications, transcutaneous electrical nerve stimulation, distraction, hypnosis, music therapy, relaxation techniques, etc. These therapies are to be used under guidance of physiotherapist only. Thank you students for watching this video. For such latest updates or latest lectures, you can subscribe the channel, you can like Facebook page, and for making your notes, you can visit mynursingstudents.blogspot.com. Thank you students.